I thought I'd talk a little bit about the use of serums and emollients. Now that the weather's changing, what can we do? Do we need to use a thicker balm in the evenings, or can we still carry on using exfoliants? Can we use things like vitamin C? Hello and welcome to this week's newsletter. Obviously, I'm Dr. Sunny Dhesi here at Vysana Clinic. So welcome. So I hope since last week, everyone has a good week. The weather has changed, obviously, no need to say that. It's pouring down with rain today. However, that doesn't mean it's going to stop me from sharing trends, sharing some information and just checking in with you, just as if you were coming into clinic. So what I had in store for you today was that I was going to talk a little bit about my background. It's something that I may have mentioned to some of you as patients, but perhaps a lot of you don't know what I do when I'm not in clinic or what I've done in the past. So I thought I'd share that with you. I thought I'd talk a little bit about the use of serums and emollients. Now that the weather's changing, what can we do? Do we need to use a thicker balm in the evenings, or can we still carry on using exfoliants? Can we use things like vitamin C? That was a little bit. And then lastly, I was going to talk about this week, but I think I'll leave it till next week. And that was about the use of anti-inflammatories. And it's really for those women who are of reproductive age. It's the use of hormonal contraception and the risk associated with taking anti-inflammatories. But there's a little bit more reading that I've got to do that. So if you are interested, please do drop me a message, because I do like feedback. I would like some feedback on, are these topics interesting? Is it engaging? Is it useful? So that's a topic that I think I'll leave till next week. So I'll leave you on a cliffhanger there. So firstly, before I talk about myself, I wanted to share a couple of things about skin ingredients in clinic. So today what I've got demonstrating is we've got some Hydrodew from Illumier. We've got RHA serum from Teoxane. And then we've got the Teoxane balm. So all reasonably priced products. The Teoxane deep repair balm for me is actually particularly good. I think it's under £40 for 30 mils. You don't have to use much of it, and it doubles up as quite a good night cream. So I think one of the things that I don't get a chance to explain in clinic is that I do spend a bit of time looking at the small print, the ingredients list here. As part of my ongoing development and training to make sure that what I bring to clinic for you is of value, I do try and look at the ingredients list. And the ingredients list, there's a phrase for it, it's called the INKI list. And if you ever are interested, if the product ingredients has been put correctly on the product, then what you'll find is that they're in order of concentration. So where they have an active product or an active ingredient, say for example in the Hydrodew, niacinamide is meant to be one of the active ingredients, which is good for pigmentation. It's an antioxidant, good for skin texture. It comes sort of halfway down, so that the higher up that niacinamide would be, the more potentially potent it would be. So what do we see at the top of most of these products? We see that they're water or aqua, which is the main ingredient. That's why it's liquid. Usually there's glycerin in there, dimethicone, propanediol, beeswax is in here as well. And there are also some esters before we get into the active ingredients. For example, safflower seed oil, niacinamide, tripeptide 38. So these are the peptides that are within the moisturizer that help to plump up and soothe the skin. So what I'm going to do now is so in here, again, the point of just demonstrating this is that I wanted to show that if you are using an exfoliating cleanser because you're trying to clear any pigmentation that you picked up over the summer, I would generally use about that much serum. That was 3 little pumps onto one finger. What I would do is spread the product around, bearing in mind I'm doing this at the end of the day, I have cleansed, and then you're able to spread and take the product quite far up and around the face. And then I tend to use both hands. So that was actually probably quite a lot of product. 3 pumps is probably quite a lot. I put more on the forehead, so it's a schoolboy error, as it would be, and then blend it in. And then when you are putting serum on the next day, maybe start by dotting it lower down the face. So that's the serum gone on. It absorbs in very quickly. This one actually has a bit of a fragrance to it. Again, looking at the ingredients list, the main ingredients for this are water, aqua, glycerin, dimethicone. But then the active ingredients, which are small chain amino acids and sodium hyaluronic acid, is about in the middle. So a pretty good concentration. Now, I'm going to do a bit of a split test just to see and describe what this feels like. So I would use 1 pump actually probably two, actually, I probably overdo it. 2 pumps of the Hydrodew, which is a moisturizer. Again, that also contains, it does contain hyaluronic acid. It also contains niacinamide, so some active ingredients in there. So if your skin is sensitive, you might find that it flushes a little bit when you're using this. So I said I'd do a split test, so I'll take that off. So what I'm doing here is layering, and this is something that I sort of maybe explain in clinic, or I do for you in clinic when you come in for treatments. So apply the serum, and then over the top, apply the moisturizer, and that's layering, which then starts to build up a kind of protective barrier for your skin. That's absorbed in very quickly. And then what I wanted to do was use the balm. This is a squeezy bottle, so not a pump. So again, I would just use about a fingertip. Interestingly, how do we measure when we're prescribing treatments in practice, perhaps NHS practice or private practice? If you're ever using a steroid cream, we tend to describe this as a fingertip unit. So 1 fingertip unit should actually cover the whole face, half a fingertip unit for half the face. So for example, if this was a steroid cream and it's being prescribed, we might say that's a fingertip unit. So I'm going to spread this around. So this has probably a greater concentration of glycerin and dimethicone, because you can feel it, it's much thicker. But again, that goes on. So again, layering. So what I would suggest, as the weather is changing, it's getting colder, the heating is getting on, you might want to use a slightly thicker, more concentrated moisturizer. And if you ever look at the back of the ingredients list, you'll find that there is a lot more water, aqua, glycerin, dimethicone, the key ingredients that make emollients thicker or moisturizers thicker. Anyway, so what was I trying to demonstrate there? I was trying to demonstrate layering technique. So after cleansing, spread your serum around evenly, and then moisturizer. The balm does sit better, the Teoxane balm does sit a bit better on the skin compared to the Hydrodew. I don't think you can see much difference in either product. One is a bit more active. If you're wanting to focus on pigmentation, it contains niacinamide. The balm itself doesn't. It is more for as a humectant or emollient to help restore skin barrier function. So last but not least, I promised to talk a little bit about myself. So I am a GP by background. So I'm still working as an NHS GP. I also work in private practice, where I work for a bigger organization where I do medical screenings and private GP. Is this something that we're bringing into clinic? Yes. Why am I doing it for another company? Is because I wanted to understand, how does a big corporate structure work? What is it that they're doing? What is it they're providing their medical screening programs that perhaps we could do here at Vysana, I can do for you. So that's what I'm currently doing. And obviously I have a life and a family, 2 beautiful daughters and a wife, beautiful wife as well. My background, I qualified as a general practitioner in 2012. I was in the army at the time. I was promoted from rank of captain to major. And when I retired from the army, I was a major. I was predominantly working with infantry battalions, which meant I was an infantry RMO, so regimental medical officer. And that did involve me deploying out to different places, whether it was in this country, going on exercise, whether it was abroad to Africa, to Afghanistan. I did a tour of duty in Afghanistan in 2014 to 2015. And so various places I've gone. My job was very different, although I still saw primary care issues. Obviously, most of our patients were men. We had female soldiers as well. You know as well as I do that my primary focus now is to be women's health focused. In my medical screening jobs, I predominantly see men. Actually, we do medical screenings for men in my other capacity. So yeah, qualified as a GP in 2012. Before that, I was a GP trainee. I did hospital-based training. So my specialities that I did hospital-based training for were obstetrics and gynecology, ear, nose and throat, so ENT, general medicine with respiratory medicine, and I also did pediatrics as well. I loved all of those specialities. ENT was more surgical based, so perhaps not so much. I was very passionate about pediatrics, but it's a tough speciality, and there wasn't much scope for it in the army. I was tempted by obstetrics and gynecology. Obviously now I have a focus on women's health, but general practice was my calling, and that's what I went into. Prior to doing my general practice training, which was predominantly in the NHS, I was a junior doctor. After qualifying from medical school at St George's in London, I did year 1 and year 2, and then I spent a year training with the army to train as an officer, not completely at Sandhurst like many officers do, but we did some training at Sandhurst and we did some training at military medical school, I think you can call it, military medical training facilities. And before that, I did a degree in human physiology, and that was at UCL. And before that, I obviously A-levels, and I grew up in Warwickshire. So anyway, I just want to share a little bit of background about me. For those of you who don't know me well enough, I don't really talk that much about myself in clinic. If I do, I stand corrected, and please email in. But I hope you enjoyed this week's newsletter. A little bit about myself, a little bit of a product focus, a little bit about how to layer products, a little bit about how to understand the product ingredients list. And yes, I'll see you next week. Thanks for watching.